honor to be here today. So I want to thank the Toronto Board of Trade for inviting me to speak. And I'd also like to thank Pfizer for sponsoring the Board of Trade's Health Series. This has become an important forum for pushing the envelope in the thinking we need in healthcare across our country. So thank you very much. I want to begin my remarks today by reminding everyone about two absolute truths. First, Canada is a great country. It is the greatest country in the world. Second, we have a great healthcare system, a public healthcare system, a system that I believe in passionately and that has been admired and modeled the world over. In what other country is the healthcare system such a point of national pride, woven into the fabric of who we are and what we want to be? But one thing, and the one thing that makes Canada great, is that we are never completely satisfied with our healthcare system. And indeed, in 2011, a great deal of our time and energy is spent on thinking of the ways to make our healthcare system better. Because the truth is, the increases in the cost curve of running our healthcare system are simply not sustainable. But Canadians have solved tough problems before, and we're going to solve the problems of our healthcare system and the ones they face now together. So there are countless new ideas, exciting innovations, and system design breakthroughs that are just waiting to be expanded, all of which have been born and raised in Canada. Which brings me to the Ivey Centre for Health Innovation and Leadership. It was created as a part of the Richard Ivey School of Business at the University of Western Ontario because our healthcare system needs an incubator for systems change. The Ivey Centre is focused on developing leadership and change management skills in health systems executives, the people who lead and manage our system. We want to develop leaders who can walk into a healthcare organization or company, assess what's wrong with the system, identify the right solutions, and drive the change that is needed. One part of the solution is training great leaders who know how to drive change. Another is ensuring that the great thinking moves from those ideas into becoming a reality. That's why the Ivey Centre for Health Innovation and Leadership encourages the adoption of innovation. For our public healthcare system in Canada to be more sustainable, it needs to become more efficient and effective. And to be more efficient and effective, it needs to become more innovative. But here's what's fascinating. Our healthcare system is completely resistant to innovation. It is resistant to change. I'm sure that's a real surprise to all of you out here today. At Ivey, we aim to find out why and to develop ways that overcome that resistance. Each year, the Centre hosts an annual conference examining innovation and leadership skills in the health sector. Last November, we hosted our second conference, and the overriding theme that emerged was the need for our system to engage consumers of healthcare in the critical decision, important tasks of transforming healthcare. That is what I'd like to speak to you about today, engaging people, the people who need and use our system in the process of health system transformation. Engaging healthcare consumers has been the focus of our work over the last number of months and will be over the coming months. We're excited. That's because we believe that one of the keys to health system sustainability is the engagement of patients, our health consumers, and the empowerment of patients to be members in their own healthcare team. So let me explain and start off by telling a story about someone who needed healthcare in our system in the last week. So last Thursday, a friend of mine with severe eczema living here in downtown Toronto experienced a flare-up and required a refill of steroid medication to ease his symptoms. I'm sure you've all had these little things where you think, well, should I be going to the emergency department or my healthcare provider? What should I do? He contacted his dermatologist and was informed he could not be seen until he had a referral from his family doctor. The dermatologist had been caring for this patient for several years, but had not seen him for over a year since his condition had stabilized. The specialist required a new referral, which would have to be faxed to his office. So he contacted his family doctor, who saw him quickly and provided the referral. The patient took it with him, but learned it needed to be faxed in. But learning what was needed, of course, like most people outside of the healthcare system since 2011, he didn't have a fax. I don't know about any of you, but I don't have a fax machine at home. But not to be deterred, he contacted a family member who had a scanner and a fax machine. Now that's a unique person in Canada now. The patient had the referral scanned and got his relative to fax it over to the dermatologist office. But the office's fax machine was jammed. And since it was already Friday afternoon, no one was going to see it until Monday anyway. So the patient on Monday morning got up, took the morning off from work, delivered the referral himself in person, and that very same person lost yet another half day of work. It gets better. Then the patient's pharmacist required an updated order since the refills had run out. Despite attempts by the pharmacy to contact the physician for a new order, the pharmacy was unsuccessful. In the end, he ended up going to the emergency department to have his refill for his cream. Now, you've all heard this story before, and one's very much like it, or you may have actually lived this story. Between 1985 and 2005, per capita spending in health in Canada rose by 50%, and it continues to rise far faster than core inflation. Last year, 11.3% of our GDP was healthcare. Canadians spend $183 billion a year on healthcare. That's more than the entire GDP of Ukraine. We spend more on healthcare in Canada than the entire annual national output of a European nation of 46 million people. Imagine how much better, in terms of patient outcomes and overall productivity, we would have in our healthcare system if we could just get serious about fixing these kinds of efficiency problems that prevent patients from getting the things they need. Imagine this scenario. How many people in this room have a child? You may not want to admit it, I get that. I see 150 children a week and I send them home with other people. So, a mother wakes up and discovers her baby has an odd-looking rash. Anybody had that scenario? Using her smartphone, she downloads a picture of the rash to a website that connects her to a physician for a video conference. The doctor checks the child's electronic medical record, has a look at the rash, prescribes an ointment. The mother can pick that ointment up at a pharmacy on her way to dropping the child off to daycare. Fast, simple, and efficient for both mother and for the health system itself. Now let's think about that mom. As it turns out, modern technologies, and especially information and communication technologies, are featured in the examples that I'll speak to you about today, and they're examples that are referenced in our white paper. But let me be clear. The way forward isn't about building elaborate technologies. The way forward is about making life easier for the mother in that story, or the patient who needed the dermatology cream. Because if technologies are not consumer-focused and designed from the get-go to make life easier and faster for healthcare consumers and providers, people just simply won't use them. People drive cars. How many of you have a car? Because they're relatively easy to drive, and it makes your life easier. People use telephones because they're relatively easy to use, and they make your life easier. People will not use technologies, no matter how well-intentioned, if they aren't intuitive, simple, and essentially instructions-free. And I learned this with my father getting a new iPhone. So, technology platforms, websites, password codes, and other gizmos that aren't really easy, really clear, and really straightforward for that mother won't help her. And to be blunt, the same level of simplicity and ease of needs in the design of things that need to be used by my colleagues have to be exactly the same in our medical profession. That is what becoming patient-centered is all about. It means seeing things from the patient's perspective, and that also includes treating people well, offering better customer service to our patients, which we need to get a lot better at. A positive experience doesn't just leave them feeling better about the hospital or the healthcare provider institution that they receive their treatment. It can also help them deliver better health outcomes. It lowers their stress. It makes them feel more optimistic. And it reminds them that the people who care for them also care about them. But what I'm really talking about is a deeper engagement of patients, getting patients thinking about and participating in the design of their own care. And in the healthcare world, this is considered quite a radical idea. Historically, our system was based on a one-way relationship between patients and their healthcare provider. It was considered taboo for a patient to offer their own opinions on how they wanted their healthcare to be designed. For our health system to fundamentally address the twin challenges of the rising cost curve and an aging population, we must find ways to reach out to patients and support them in independently managing their own care and wellness, so that they will have a less need for using expensive hospital care. Now, I spent a lot of time in hospitals, and many of my best friends and most esteemed colleagues work within them. But let's be honest, no one really wants to be in a hospital, unless they really, really need to be there. The vast majority of people would rather get better at home, in the comfort of their own living room, with their own television set that they don't have to pay for. Now, the good news is that we have a whole new generation that is aging on the one hand, but highly rebellious and independent, and very happy to try new things out on the other. This is a generation that demographers call the baby boomers. They are helping lead the way. Baby boomers have always valued independence and wellness. They have pioneered social reform and are willing to embrace social change. And many are also technologically savvy and sophisticated when it comes to information technology. In other sectors of the economy, boomers have encouraged entire industries to transform themselves, turn upside down, and adapt to them. For example, TD Canada Trust talked to its customers and found that they had no time to do their household chores and actually make it to the bank on Monday to Friday. So TD responded by opening up some branches on Sunday afternoons. Remember when banks were only open on weekdays between 10 and 3, and sometimes even closed early on Wednesdays? This is responsive. In the banking sector, like the tourism sector and other sectors of the economy, quantum leaps have been made in efficiency and customer service. They recognize that you can serve people better with less risk of error while making our systems more efficient at the same time. Customer needs have driven other sectors to modernize and become more efficient. The same can be done in the healthcare sector, or at least I hope. Market research shows that 52% of Canadians believe healthcare requires fundamental change. 10% believe the system actually has to be entirely rebuilt. In other words, the climate is right for engaging patients who are frustrated and want change at a system level. The time is right to harness the power of consumers. Which brings me to our white paper, which I think has been distributed out to you, Transforming Canadian Healthcare Through Consumer Engagement. The white paper we are releasing today is built upon the founding hypothesis. For health system reform to be meaningful, sustainable, it needs to be based upon health consumer engagement. Evidence shows that when a patient is better engaged in their own health care, is empowered with information, and is equipped with tools he or she needs to engage in their own care, they will be healthier, enjoy a higher quality of life, and will not need to access the more expensive parts of our healthcare system. And to achieve health care quality and sustainable goals, health provider organizations need to understand who their key consumers are and what those patients are demanding. That way, they can engage and empower consumers in their own health care. The question is how? Our white paper lays out 5 strategies designed to increase healthcare consumer engagement. First, health systems need to create structures and opportunities for patients to engage fully in their own health care. Evidence from other jurisdictions shows that impressive results can be achieved when patients are empowered to manage their own health and when they are asked to be part of the decision-making process when it comes to specialized services. Engaged and informed consumers make better decisions on their own healthcare needs and goals. Engaged consumers when we start with giving them the information they need, make better decisions. Online technologies can help do this. Some are simple, such as appointments and referral management systems. Others are more complex, such as medication records and self-monitoring of chronic diseases. All these are critical building blocks that patients can use to get better control of their own health. Now, in the healthcare community, we've heard this all before. The proponents of health technology have long promoted the benefits of digitalizing our health records and administration systems, and have stated those benefits in terms of increased efficiency, lower cost, and fewer errors. And all of these great arguments have resulted in a frustratingly low adoption of these things, and relatively little tangible results to be seen for the billions of dollars of investment. Our belief is that by making healthcare consumer needs the primary driver of technology and not the administrative processes of the system, we can get further faster. If the consumer was the center of the model, over time, they would demand better, more convenient access to care. Just like people no longer have to fill out those pieces of paper when they withdraw or put money into the bank, as more consumers learn about and appreciate the benefits of not having to repeat their medical history again and again and again to a specialist, the more they will adopt an electronic patient record. The second strategy is engaging consumers is decidedly more focused on the way health practitioners work with each other and how they interact with their patients. Simply put, consumers are demanding that the entire healthcare team involve patients' care more efficiently and communicate with each other. Health consumers will demand in this day and age of 24/7 mobile communication that every member of the health team should have access to their information that they need. Streamlined information systems, for example, using handheld technology, mobile devices, support communication in real time, and will end the frustration of staff consistently waiting for a response from a doctor on call, a nurse who is with a patient, or a surgical team completing a procedure. With the pervasiveness of tablet computers, every healthcare practitioner today could have secure access to almost all the information that they need. But we don't do this. From drug interaction data to complex high-resolution digital radiography, images that could be shared with just the press of a button. Patients who have the benefit of their own healthcare provider following best practices, collaborating on their care in a holistic way, and making more timely decisions with all the facts before them. And that would make fewer mistakes, improve efficiency, and result in better outcomes for patients. Third, new technology and software being developed for our health system must support greater consumer engagement in accessing the healthcare system. Up to this point, overriding concerns of healthcare technology developers has been to create a bulletproof security system and completely closed to the outside world. While protecting privacy must remain an important component of system design, it's time to get with the program. Let's let people gain access to more of their own health records and let them determine who it should be shared with. Let's let the patients have access to information and knowledge that could help and enhance their diagnoses. For example, new technologies are emerging around the world that automate best practice guidelines. That way, if a best-in-class approach for teaching a certain kind of cancer was developed here in Toronto, they can learn about it and implement it more quickly elsewhere around the world. Today, these knowledge resources are only available to healthcare professionals. Why not make them at least available to patients and to their family members? Does that mean that patients will entirely be responsible for their own diagnosis and treatment regimen? Of course not. Ultimately, it's the physician and healthcare team who will interpret and recommend the most appropriate course of action to a patient. But having the patient involved in the problem-solving process is key. In fact, the more active level of engagement will result in better downstream consequences and an improvement in their health outcomes. Software developers need to create open, accessible technologies that simultaneously serve the needs of health professionals and health consumers, allowing them to engage one another in choosing courses of therapy that meet individual patient needs. The inclusion of patients in personal information systems supports informed consumer decision-making and strengthens personalized treatment regimens. Personal healthcare platforms such as TELUS's HealthSpace go a long way to achieving this. But what's truly exciting about these technologies is that we don't know yet where these innovations will take us. We haven't even dreamed yet of the next generation of apps on these platforms that could someday transform the way chronic diseases are managed. Our fourth strategy focuses on the structures and capabilities needed to reach out to consumers and support health and wellness at home. As I mentioned earlier, hospitals are expensive places to provide care, and there is no shortage of truly sick people for whom care within a hospital is completely appropriate. But to control spiraling health costs and bed shortages in the years to come, our health system needs to do more to provide care for people in their homes. Providing support to help patients monitor and manage their own conditions with the support of a medical team based in a different location. Connecting health practitioners and people in their homes offers health consumers personalized services that can reduce the constant and costly demands of health services in hospitals and clinics. A few months ago, I saw a demonstration how a straightforward technology that most of us have in our home, a digital cable box and a television. How many of you have one of those? right? Could be used in as a two-way communication device. It can allow an entire chronic healthcare team to interact with a patient struggling with diet and exercise regimen who has a chronic disease. The patient or family member would upload their heart rate, blood pressure, other data that would be viewed by a nurse or a doctor throughout the day. If there was a problem, the patient received a telephone call asking her to join a conversation with her physician on a video conference using her television. She would also get coaching and other information on diet, exercise, feedback through her TV. Novel, hey? The patient never has to leave home. The doctor doesn't need to take a time-consuming house call. And the entire engagement can be done quickly and efficiently. Bringing another family member into the healthcare provision is just as easy as doing a three-way telephone call. Here's another example. Research in Motion, the University of Toronto, George Brown College culinary arts students have partnered in pushing customized menus tailored to different ethnic communities out to people who have diabetes throughout the poorest neighborhoods here in Toronto. Mobile devices provided by RIM upload blood pressure and sugar data to the nurses and physicians who monitor their progress. And menus, exercise plans, and personal coaching is pushed out via instant messaging. The patient is empowered with information and becomes much more involved in the management of their own care. The fifth strategy we highlight in our paper is system integration. Some have said that we don't really have a health system. We have a number of independent silos that simply don't talk to each other, let alone provide a holistic, integrated approach to care for our patients. That's why we need to streamline the flow of health information through integrated channels of communication to connect healthcare agencies more directly. Our healthcare system needs to integrate all of the different isolated repositories of data we have. The idea would be to provide healthcare providers and patients easy access to information, making it easier for members of a healthcare team to share information, records, data imaging, and chronic illness management ideas. To be clear, this doesn't happen very often in our system today. Usually if you get a referral from to a specialist, your family doctor faxes, that infamous fax word again. We doctors are really good at faxing things, by the way, over to only the most pertinent information that he or she thinks is important for your specialist, not your full health record. Getting access to your own healthcare records is also a challenge. So creating one single integrated health record for each patient is far easier said than done. Too often in the past, technology has been deployed that has reinforced the inefficient and ineffective business practices that were once paper-based and are now electronic. Other sectors went through this transformation. Remember when accessing government services online meant printing off the form and mailing it back? So, healthcare technology today is still far too often like that. Instead, health technology needs to be thought of as an opportunity to completely rethink how our business practices are applied to health. Let this be an opportunity for revolution, not simply evolution. It's not simple, but it will be achievable. We need to redesign, and we need to ask ourselves why we have some of these processes in the first place. Consumers are demanding it. They deserve it. They're demanding a system that is seamless, integrated, and communicates critical data. They want it to be easily accessible information, but they also want to be ensured that it's private, and that means we have to think differently. And most importantly, the consumers want it to be trusted, respected, and they want to be empowered, especially if the information in question is related to their own health. So these 5 strategies we laid out in our white paper are all enabled by technology. And there is no doubt that technology has a critical role to play. In every other industry sector you can think of, from banking to retail to manufacturing, the deployment of technology has transformed the industry and made it more efficient and created entirely new economic models and businesses. Healthcare is no different. But I don't want to leave you with the impression that consumer engagement is only about the technology. There are other ways that consumer focus can have an impact on healthcare delivery. You know, just a few years ago, Trillium Hospital in Mississauga began the process of building a new hospital wing. They engaged their patients and asked them what they wanted out of their hospital experience. They expected to hear things like, I want better food. I'm sure we would all like that at a hospital. longer visiting hours, and they got some of that. But the overwhelming desire of patients who were there for a long period of time was that they wanted a bed that faced the window. So we've all been in those semi-private rooms. One side of the room gets a window and the other gets to look at a curtain. At Trillium, simply by engaging patients in the design of their hospital, all of the beds now sit on a 45-degree angle. Everyone gets window space. So what a great example of a small thing, just by engaging their consumers to change the design of what they're doing at their hospital and improving everyone's outlook of the hospital. The opportunities for our health system are exciting. Meaningful change means reversing the paradigm with our medical model. It means actively engaging patients in their own care. It means thinking about patients as customers and not simply as outputs. We must trust and empower our patients and their extended networks of caregivers, friends, and family with the information and tools they need to better manage their own care. If we do, we'll finally have a system that is sustainable and that focuses resources on those that need it most and have a population that is healthier and more productive. Canada has a proud tradition of excellence in healthcare. This is the country of Banting and Best. It is the home where pioneering work in surgical treatment, much of it done just a few kilometers up the road from here, and it is the country of Tommy Douglas, whose concept of public universal health care has helped shape who we are and what we are as a people. Let us take inspiration from the innovation and creativity of the past and apply it in this new age, unleashing powerful idea of placing the patient at the center of the design of our 21st century healthcare system. Such a shift might not sound that revolutionary. It might actually not even feel like a quantum leap, but it is. And if we can embrace a new way of thinking, our young new century will be a time, once again, when Canada leads the world in healthcare thinking and innovation. Thank you very much.